Hi and welcome to the channel. In this video, we have 6 new leads. In the previous lecture, we completed the 6 limb leads. Together, they made a complete clock face around the heart. This covered every angle in the frontal plane. But before we continue, there's a term we've been using that we never actually explained: the frontal plane. The frontal plane is the flat surface that divides the body into front and back. Imagine a sheet of glass passing through your body from head to toe. Everything on that surface, left, right, up, and down, that's the frontal plane. And all 6 limb leads live here. They watch the heart's electricity moving left, right, up, and down within that flat surface. And the frontal plane tells you everything happening from side to side, nothing from front to back. And that's the blind spot. The frontal plane can't see depth. It can't tell you what's happening towards the chest wall or away from it. And the right ventricle sits anteriorly, closest to the chest wall. The left ventricle sits behind it, further back. The limb leads can't see that difference. For that, you need a completely different plane and a completely different set of leads. So we add 6 more leads, placed directly on the chest, looking at the heart from the front. Imagine slicing the body horizontally, a cross-section. This is the horizontal plane. The horizontal plane divides the body into superior and inferior parts, and the chest leads live here. Where the limb leads in the frontal plane show you up and down, left and right, the chest leads in the horizontal plane show you electricity moving toward or away from the chest wall. Together, they cover everything. The frontal plane plus the horizontal plane, 2 planes with 12 leads, giving us the full picture. The chest leads are named V1 through V6, and their placement is deliberate. V1 sits at the right sternal border, the right side of the chest, in the 4th intercostal space, closest to the right ventricle. V2 mirrors it, but in the left sternal border and the same intercostal space. And from there, the leads sweep across. V4 drops to the 5th intercostal space, mid-clavicular line. And V3 sits between V2 and V4. V5 stays at the same level, but in the anterior axillary line. And finally, V6 moved further left in the mid-axillary line and in the same horizontal level, closest to the left ventricle. V1 to V6, a sweep from right to left, from the right ventricle to the left ventricle. Think of it like a rotating camera around the heart, moving horizontally. Each lead is a slightly different angle, and each one seeing a slightly different cross-section of the same electrical event. As you move from V1 to V6, something changes in what each lead records. In V1, the upward deflection is small, almost absent. V1 is sitting closest to the right ventricle, facing away from the dominant electrical direction. The electricity is mostly moving away from it. As you move across V2, V3, and V4, the upward deflection starts to grow progressively, because each lead is getting closer to the direction the electricity is flowing. By V5, the upward deflection is usually at its tallest, Because now the lead is facing almost directly towards the left ventricle, toward the dominant electrical force. And therefore, we have the wave small in V1, growing progressively, tallest in V5, and that's the normal pattern. And there's a point somewhere in the middle, usually around V3 or V4, where the upward and downward deflections are roughly equal, neither fully positive and neither fully negative. The lead is sitting perpendicular to the electrical direction. This is called the transition zone. And knowing where it falls tells you something important about the heart. So now we have 6 limb leads and 6 chest leads. 12 leads in total. And now you know why. Because 6 are watching the frontal plane, left, right, up, and down, and 6 are watching the horizontal plane, front to back, from the right ventricle to the left ventricle. 12 windows all recording the same heartbeat at the same time from 12 different directions. But knowing that the windows exist isn't enough. You need to know which window looks at which part of the heart, which leads watch the inferior wall, which watch the lateral wall, which leads watch the anterior wall, and that's what we have in the next lecture, the lead groupings. That's all. Thank you and see you in the next lecture.